I know there's a lot of listeners and watchers today that are saying, I do dentures, but it's not predictable, it's not efficient for me. I have so many appointments just to make it right, and I think you can help them with that. Not only make it more profitable, but also more practical and more enjoyable. Second thing I want to talk about is dentures. I mentioned, and you've known me for years, and I always push away from dentures, and they always say it's grief or gravy, and it seems like I never saw the gravy. It didn't matter how many times I remounted it, how expensive teeth I used. They could never eat anything with my denture, but everything with the denture they brought in that's missing teeth and has a roller coaster plane of occlusion. So it's like, I don't want that. And yet, I hear you, and I've seen your presentation on what you call smile design dentures, and you say, oh, how easy is this? Look how easy this is. Look how easy this is. And look, it's 3 visits instead of the 20 that we had in dental school. And I think, why am I not doing that? And then as you describe what you're doing, you have a smile on your face, which means you like it.
I do like it.
I don't. So, I'm doing something wrong, and I think there's watchers today that are thinking, I do them because I have to, whether I'm in a rural town in Mississippi or I have a general practice in Los Angeles. There's patients in my practice that need dentures, and I can either charge a whole bunch and do it right, or do it wrong and don't charge much, and neither one of those I think work really well.
There are several things that we need to focus on, and whether we're going to be seeing a patient who has existing teeth and we're going to be converting them to an immediate denture, whether we're going to be doing a brand new denture from a wax rim, or whether we're going to be using their existing denture as a launching point to create a mock-up, there are certain key things that the laboratory really need to make that case perfect. One of the things, of course, is having a simple, straightforward tooth selection system. And I love using the Ivoclar system with the form selector, and that plus a shade, and you can get beautiful teeth for any denture that you want to do. The first thing they need to know is, where's the midline going to be? The second thing, of course, is where's your incisal edge going to go? And where's that incisal edge position vertically, and where is it in profile? And then the third thing is really, what's the arch form look like? And the funny thing the way I remember this is, before a case goes out of my treatment room with the patient, I need to give that patient the blessing. I call the blessing, that's the patient, they need the midline, you need the incisal edge, and you need the buccal corridor. You need to know what the arch form is. It's just a simple way for me to remember that the lab needs those 3 things. And then the last thing, of course, is great impressions and a great bite relationship that's done in a simple, straightforward, predictable way. And those are things that we love to teach in our denture program, is how to do those very basic things in a straightforward, effective way that's predictable and gives the lab what they need to give you a gorgeous denture back.
Yeah. And you're going to show that in the course. We're going to do have an edentulous patient where we'll show how to take impressions and how to utilize border molding, because I know, looking at dentures at Keating and other dental labs, a lot of you are not doing that, and because it takes too much time and it's not as predictable. So a patient comes in with an ugly denture that doesn't stay in, very predictably, you can do a couple implants, do an overdenture, a beautiful denture with minimal visits, and change that person's life in an unbelievable positive way. So.